Dr. Seng, a psychiatrist with special interest in mental health disorders in the elderly. I treat mental disorders, including mood disorders such as depression and bipolar disorder, and also psychotic disorders like schizophrenia. And I also see patients with insomnia, anxiety disorders, stress-related disorders, and dementia. I chose to practice psychiatry because I always find the brain and the mind very fascinating, and also that it's a specialty where it allows me to touch the lives of people, and I find mental health so important and yet often neglected. Psychological pain actually sometimes can be a lot worse than physical pain, and yet patients are often misunderstood and stigmatized. So I hope to advocate for good mental health, and I believe that patients with mental disorders can actually be treated and live fulfilling and satisfying lives. Challenging moments I face include patients who may be at risk of harm to themselves and others, and yet refusing treatment. So it's very important to establish a good rapport with them so that they can trust us, but that requires a lot of patience and empathy. Most satisfying moments include when I see my patients recover, grow, improve the quality of their lives, even experience joy, gain confidence, and function well at work and in society, and even find meaning and their purpose in life. I recall recently a patient actually called the clinic to look for me. She's a patient I treated for depression, and she was discharged well, and I thought she was going to have a relapse, but she just wants to say thank you that she just celebrated her birthday. She's happy and coping well now, and she never thought that this day might happen because she was on the verge of giving up previously. I always remind myself that as doctors, we can only cure sometimes, but we can always treat often and comfort always. So I think we should always give encouragement and hope to our patients.